Hey guys, Daniel here with HRT, and today I want to show you our IFAK kit. And to help us do so, we've brought on Scott from Tourniquet Tactical. He's going to give us some of the information on this kit, and you want to share some of your experience?
Sure. Hi guys, I'm Scott with Tourniquet Tactical. Just my tactical experience goes back to with the Portsmouth Fire Department. As a part of that, we run with our city SWAT team. Do some work with the U.S. Marshals, and I've been in the Army, the National Guard now for 21 years in August. And again, we do own a little company called Tourniquet Tactical that trains the large part of the SWAT medics that operate in the state of Ohio and beyond.
So thanks for stopping by and letting us talk about some of these things. And thank you for all your work in the industry there. Specifically with our IFAK, it comes in this prepackaged little kit. So you get all your components on it when you order it. It comes to you like that. Right. And then from that point, what would you recommend doing with this kit?
Well, once you receive that kit, the first thing to do is get it out of the packaging. That's not what you throw in the door of your car. That way, if you need it, you have it. In the heat of the moment, if you got blood on your hands or sweat on your hands, in the heat of the moment, you also lose fine motor skills. That's going to be a very difficult package to access. So the first thing I would do, open that thing up and get it into your kit, into a better storage situation, whether it's a little bag or something that you place in your car. But first things first is let's definitely get those out of the plastic and into something that you plan to have in your vehicle or somewhere on your person, if that's the case.
Sure.
First thing.
Cool.
All right. Now, there's a couple of things that I would like to see if I'm carrying my own IFAK, and certainly these are the things I think first and foremost I would like to see in my IFAK. And what I really appreciate about this particular kit is the removal of a lot of what I would consider extra stuff when you look at early IFAKs back in the day. And I think early IFAKs then were really fashioned after what they were carrying in the military. And in that case, they were carrying a few more things because they were in a more austere environments, right? So first things I like to see in here, you have your bleeding control components. And when we're talking about bleeding control, something else to note is it's not part of this package, but somewhere very close by or somewhere secondary to this kit, you're going to want to have a tourniquet right nearby. And because this is going to be your first line, compressible hemorrhage, extremity hemorrhage, this is what you're going to want to start with, and this should be part of kind of an ancillary part of this kit right here.
Right.
So now moving on into this, let's just start continuing on with the bleeding control aspect of it. We have a couple of things here in place, and I like to see this. So we start off, we do have our hemostatic agent here, and the hemostatic agent of choice in this kit is going to be our combat gauze made by folks at Quick Clot. This is good stuff. And then next to it here, you have the 4-inch ETD trauma dressing. So when we talk about wound packing, there's a lot of debate right now, and there's some pretty good data, some research, some discussion, and I enjoy that. I am one that I don't have my mind necessarily set. Once I learn something, I'm willing to change it if someone explains to me why, or if I read something that explains to me why.
Sure.
And right now, there's some pretty decent debate about the difference between just your regular gauze and your hemostatic agents. And one of the things you're seeing out there is, regardless of which one of these you use, they're going to be pretty equally effective. Now, I think there's still good evidence, good data to support. Let's start with the hemostatic agent, then follow that up with something like your trifold gauze, a rolled Curlex, things like that. In this case, we have a nice compressible 4-inch ETD here that we're going to use in conjunction with the combat gauze, and I think that's a great combination.
Okay.
So we definitely want to get started with packing that one with our combat gauze, and then we'll follow up with our 4-inch ETD here. Very, very good combination. Something else as we move on here, we have our NPA, our nasopharyngeal airway, and along with attached to that is going to be your water-based lubricant. A very simple airway adjunct. Anyone can learn to do this. And what I like about the NPA is you can apply it to someone that is conscious, semi-conscious, someone that's semi-conscious that may become unresponsive. This will certainly, it's very simple to use. It's not quite as invasive as other airway measures, and it will keep that airway open, keep that tongue off the back of the throat for someone that is now unconscious, flaccid, and on their back perhaps.
Sure.
So very simple, very, very good airway adjunct. And especially when you consider an IFAK, we can't get much else in these things, right? So, so when you look at packing an IFAK, you've got to get something that's going to be effective, but it's also going to be something that doesn't take up a lot of space, right? So this certainly fits the bill and still very appropriate for our IFAKs.
Excellent.
And then as we move down, as we talked about airway, we do have our chest seals in here. Another thing that there's a lot of discussion about right now is our chest seals, right? So We're looking at our chest seals. This is going to be the hyphen. This is a vented chest seal. And that's kind of where we're at right now with chest seals. You know, you go back and forth. Did you tape up 4 sides when you used them back in the day? Did you leave a third side open and just tape up 3 sides? And that would change about annually, it seemed like. And then then you had your hyphens that came out. The first ones were the great big green ones, and they were just 4-sided. You slapped them on there. They had an adhesive on there that when you removed it would take off hair, skin, maybe a rib or two with it. They were fantastic seals. But then as time goes on, we start to think, well, we need that to be vented. We need for that to have a way for air to escape potentially. So that's when they started coming up with these vented chest seals, and they have evolved even in time. The first chest seals they had a very thin vent. The argument was, once those clogged with blood, they basically just become a 4-sided chest seal anyway. So they started to develop to where the hole that you place over the wound is a little bit bigger. The tracks that let the air escape, they're a little bit wider. So I think there's been some improvement there for sure. But there's great discussion, I think, that we're going to get into later about how relevant are chest seals now. But until those discussions come to a conclusion, and then you have your COT-CCC actually come out and change the standard of care, this is definitely something we want to continue to carry in our IFAKs. Again, nice little space saver. These are the twin packs, and these are, until we decide otherwise, these are still a good frontline treatment for those sucking chest wounds. All right. Moving on, and I think one of the most underrated pieces of equipment in any IFAK, any medical kit, any trauma kit, anywhere, it's the simplest thing. They're very inexpensive. They don't take up any space, but it's the survival blanket. We have a survival blanket here. Is basically, you've seen them referred to as Mylar blankets, aluminum, space blankets, whatever you want to call them, but it's labeled here as a survival blanket. And I think what a lot of people may or may not realize in a trauma patient is trauma patients, they don't clot well for very long. They may clot initially, but hypothermia, without making this a medical lecture here, but one of our points in the triad of death is a patient that gets hypothermic. We know the hypothermic patients do not clot well. So a key thing, once we take care of those life-threatening things, once we stop our bleeding, once we manage an open airway, is going to definitely be, we got to start conserving body heat. Because once their temperature starts to drop, even a drop of core body temperature of 1 degree can have a large effect on the ability to clot. So we definitely want to keep those patients warm. If we can get one under them and over them, that's ideal, but really just getting one over them, getting one around them. These space blankets are largely underrated and probably underutilized. But honestly, once you stop bleeding, I don't know if there's a more important piece of equipment in this IFAK than a blanket like that. And then the last thing that's kind of included in your kit here, there is a little roll of gloves here. And when you get your debates on gloves, you start talking about, well, the colors and the types of glove, and I see that they use black here, and there could potentially be someone that's going to question, well, why are we using black? Well, when we're doing our blood sweeps, will we have an issue seeing blood on our hands? And I get it in theory, but I think if we're good clinicians, and if we are doing a good assessment, we're going to use something other than just the color of our gloves to determine if someone is bleeding on us, especially massive bleeding. And I would also humbly submit to you that, as we're doing our blood sweep, if there's an area of more than one bleeding, once you find blood on one area, that your gloves are now tainted anyway. Right. So when you get to that next area and you find more blood, maybe, is that new blood or is it the old blood? So I think the color of the gloves and the types of gloves, I think that's a discussion that's largely, it's really a moot point if you think about it. Just put gloves on, protect yourself, protect your patient from you if that's necessary. Right. And just do a good blood sweep. Be very cognizant of what you're doing. I understand that, again, the black color in the dark could be an issue. I don't think really it is. I don't think it's going to, again, once you do that initial sweep, I don't think it's going to become an issue, especially if we're doing a good assessment as good clinicians.
Could that maybe stem from a training environment where maybe the instructor is trying to get the student to think about the colors, and then later the student thinks, well, I have to have this colored glove later?
I think any action that a student or a provider takes in the field or takes when they prepare their kit is most likely, I would say, the vast majority of the time, is going to be something that instructor has taught them for that very reason. So they're going to carry that with them. And then a lot of times, we have people like this, and I'm not saying it's necessarily a bad thing, but you have folks, and then once they learn something a certain way and it works for them, they will not change. So that's where that's where I get into let's do research, let's do discussions, let's create a little controversy to create the discussion, and then find out what truly is correct and what truly does work.
Right.
So yeah, I think anytime you get a trainer that saw something like that, it's going to carry on, and then that person's going to tell the next person. That's how these things happen.
Right.
And I get that.
So of the things that are out here, is there anything that's missing that maybe we should add or you would look for in your own kit?
The only thing I think that if you could find the room for it, and if you can make the room for it, maybe something to expose wounds once we get to that point. So maybe a set of trauma shears. And the thing about that is, and I do this myself, my trauma shears are located elsewhere on my kit because I use them for other things. Right. I might have to cut some restraints, or I might have to do something else with that, or cut a seatbelt. There's a seatbelt cutter on mine. So that might be a personal preference thing. But really, if there's anything missing, maybe it would be that, and maybe even one of the smaller sets of shears. But even at that, I think most of the time people's going to have this placed somewhere else, again, just as a personal preference on how they set their kit up. But outside of that, and that's just a personal, and that's really getting nitpicky. I think the thing about this kit is it has the necessary items. It's simple, it's not bulky, and it has everything you need in there to take care of those preventable causes of death that we talk about a lot. You have everything contained in here in a very nice, compact package.
Awesome. Thank you. We do obviously sell an IFAK, and it's kind of geared around getting these items into it. So if you get this whole kit and you want to spread it out like we were talking about, open it up, this is a great place to put it. Or anything else you might want to add like that. Although you probably wouldn't put your shears in here, but we have some solutions for that too. Sure. If you were to look at some of these kit items as well and say, hey, like you said, 2 space blankets would be better than 1.
Sure.
We have things like that individually on the website too. So if you need to grab extra chest seals, extra gauze, extra gloves, things like that, we have individual items like that. So if you did, it's a good idea because you lose a lot of heat through the ground.
Well, you do.
So I would sleep on mats and everything.
Absolutely.
So that's a great idea. Just something, and it's not too expensive to throw in extra.
Right.
So the little things like that are pretty important. That's a good point.
Absolutely.
So this is our IFAK system. If you don't have one, check out either ours or get some other information from different sources. If you're looking for training, check out TriMed Tactical. And if you're looking for some of the individual items, you can check us out at HRTTacticalgear.com. And thank you again for coming on and explaining some of this and giving us some extra things we need to think about.
Thanks for having me. Enjoy it.
Thank you.